Go ahead.
In addition to prenatal vitamins, do you recommend any other supplement for your diet?
So in addition, first of all, you need to understand that the number one recommendation most doctors give their patients, take a prenatal vitamin. And most patients don't understand, or women who are trying to get pregnant, that in order for the vitamins to be really effective, you need to start them about 2 to 3 months before you get pregnant. There's a condition called neural tube defect, and that occurs more often when women do not have enough folic acid. There are certain foods that are rich in folic acid, but you still need to supplement your diet with additional folic acid, about 400 to 600 micrograms. And that needs to be started about 2 to 3 months before you get pregnant to reach certain levels. The neural tube closes about 3 to 4 weeks after you get pregnant. So that's really the time. Most women don't even know they're pregnant until 3 to 4 weeks afterwards. So we all recommend, the Surgeon General recommends that all women of childbearing age between 15 and 45 always have vitamins. Having said that, there are many different kind of vitamins. So before you take a vitamin, read how much vitamin is in each pill. You go to a store, you compare 3 different vitamins, they all have different amounts of vitamins. And you should take the one that you feel is the safest and has the normal amount of vitamins. It's about 100% recommended dose of vitamins that we say. In addition to this, the only thing that's really missing from those vitamins is calcium, because calcium is very bulky, and you cannot really make a vitamin pill small enough for people to swallow that has enough calcium. So if you don't add calcium to a regular diet, we recommend about 800 to 1,000 milligrams of calcium each day. And then there's omega-3, which you can get with eating regular fish, but there's some people who recommend to add omega-3 to their daily diet.
And if you're thinking about having another baby, which right now you're like, whew, what are you talking about? You don't need to stop taking your prenatal vitamins, because a lot of people these days do have babies pretty close together. And then if you just keep, once you're in the routine, just keep going.
And what's even more important, or equally important, he has to take a vitamin too. Because if he should take a vitamin too, because his swimmers need to be healthy enough to get somebody pregnant. So oftentimes when people can't get pregnant, it's his responsibility. About 50% of the time when somebody's infertile, his sperms are not okay. So taking a vitamin, not a prenatal vitamin necessarily, he's not going to get pregnant if he takes a prenatal vitamin, but taking a multivitamin for men is equally important as it is for women.
Yeah. Is it considerably more difficult for vegetarians to meet the nutrient levels that they need to?
Vegetarians need to pay a little bit more attention to the protein intake that they have. It's not more difficult. There are big societies where people have children every day, where people are vegetarians, so it's not a big deal. But you just need to be aware that if you are a vegetarian, there are different levels of vegetarian. Do you eat chicken? Do you eat fish? Or you don't eat chicken or fish, or even if you're vegan, you don't have any eggs. So you need to balance out your diet to make sure you get enough protein. It's usually the protein that is lower in vegetarians. And there are many kinds of food that have a certain amount of proteins that may help you eat your balanced diet.
I keep hearing mixed things about cheese. What's your thoughts on cheese? Like all kinds of cheese, okay?
So the question is about cheeses. You're from England?
We love cheese.
You love cheeses. I'm from Germany. The cheeses from Germany are not well known around the world for good reason. But the problem with, there's a condition, there are 3 actually problems in pregnancy women need to be aware of. One is mercury, we touched on it a little bit in certain fish. The second one is an organism that you bring up, which is in cheese, it's called listeria. Listeria, L-I-S-T-E-R-I-A. And that's an organism that's an unpasteurized cheese. It's also in different kind of unpasteurized cheeses. So having listeria in pregnancy increases your risk of miscarriage, premature labor, or having a sick baby when the baby is born. So you really don't want to get listeria in pregnancy. If you get it outside of pregnancy, it's usually not an issue. You get a little bit sick, you get nausea, you throw up, you have diarrhea, and after a couple of days it goes away. But if you're pregnant, there's a second patient, second person that gets affected. So there are many different precautions pregnant women should take not to get listeria in pregnancy. And unpasteurized cheese is one of them. They did studies all over Europe where they found about 8 to 12% of all cheeses in Europe carry listeria. Most women don't know that. Mexican cheese can have. So you should really eat pasteurized cheese if you eat cheese. Hard cheese is okay. Swiss cheese is fine. It's not all cheeses, just the soft cheeses that are unpasteurized.
And you could ask, most New York City restaurants anyway, they don't have unpasteurized cheese anymore. So you can just ask what it is. In Europe, it's much more common to find the unpasteurized cheese than it is here.
The other problem with some of my patients, I've had 3 patients, not my own, but of my colleagues who had listeria over the last year. And they usually got it, all 3 of them, from fast food places. When you go to the Food and Drug Administration, they have a website, food website, they will tell you every single day, every other day, there are warnings from companies whose products have listeria or salmonella in them. But listeria is the most dangerous one. It can be found anywhere.
Where was it? What did they eat it?
All different kind of food. Frozen food,
Oh my gosh.
sprouts, cheeses made in fast food restaurants. Fast food restaurants specifically when they put it into a microwave does not destroy. People think you put food into a microwave. So one of the most important tools in your house should be a food thermometer. Most people in America do not have a food thermometer in their house. You need a food thermometer to find out, to make sure that the food you cook is thoroughly done. Fast food, I recommend not to have during pregnancy. You never know.
How much exercise do you recommend during pregnancy?
I recommend that every pregnant woman should have exercise, and you need to balance your exercise according to what your needs and what your body can give you. You shouldn't start any kind of what I call crazy exercises for the first day in pregnancy. That's the wrong time. But walking, swimming are good exercise for people who have not done anything before. And on the other hand, there's some very extreme exercises like certain yogas, which people do in heated rooms, which we do not recommend to do. And then there's those things with bicycles. Spinning.
Not a good idea.
Not a good idea in pregnancy. And what I usually tell my patients how much they can do is listen to your own body. Your own body tells you to slow down or stop.
What about the first trimester?
People have run marathons in the first trimester and had completely normal babies. So it really depends on your body and depends on how much you can tolerate. Make sure when you exercise, drink enough. Make sure you're hydrated. And don't get dehydrated. That's really important when you're pregnant. You need more fluid than when you're not pregnant.
How come spinning is more damaging than like running or something?
It's not damaging, but your cardiovascular system in pregnancy can only take a certain amount of exercise. And spinning is probably, I think, I've never done it, so it's probably one of the more extreme ways to do exercise, I believe. Mm-hmm. And we don't recommend extreme exercise. Now, usually people don't hurt themselves with spinning. There are other exercises we don't recommend because you can fall more likely. So those are the other exercises like any kind of contact sports, horseback riding, you should be careful with.